You're watching Good Day Austin on Fox 7.
Janet Jackson stepped out in London this weekend for the first time since announcing she was pregnant. And some asked if she was too old to have a baby at the age of 50. Dr. Sharyar Kavusi joins us now to answer that question. He's a reproductive endocrinologist at St. David's South. Good morning, doctor. Great to have you here.
Good morning, Amanda. Thanks for having me.
Let's get right to it. How late is too late?
So, too late. That definition's hard to define. Everybody has their own story. There's the eye of the beholder. And biologically, women have a very good shot at getting pregnant unless there are any fertility factors, just from an age standpoint, until about age 37 in the general population, based on statistics by the American Society for Reproductive Medicine, the ASRM, our medical society. Between age 37 and 40, the pregnancy rates decline in the general population. So it's harder to get pregnant after age 40.
If you get pregnant after the age of 40, or even like Janet Jackson at the age of 50, are there any medical consequences?
Well, there are some arguments for and against the idea of women of advanced reproductive age, which is defined as women over the age of 45 becoming pregnant. And there are some proponents and actually some opponents, too, of the idea, obviously, because it is a controversial topic. The thought is that the pros are that a woman has a right to reproduce. There's a reproductive right. There's even the thought that maybe, if you think about it, men can father children into
Hugh Hefner.
Oblivion, apparently. And Hugh Hefner, that's right. And women who are in their 50s, why discriminate against the idea of a woman who's in her 50s getting pregnant as opposed to a man not being discriminated against? That's one thought. There's the efficacy of the procedures, and it depends on how the woman gets pregnant. So to scale back at pregnancy rates, women basically, and to talk about pregnancy rates, scaling back to that, women over age 45 have a less than 1% chance of getting pregnant with their own eggs in real time. So if they're trying for pregnancy, whether it's IVF or non-IVF, women over age 45 have a less than 1% chance of getting pregnant with their own eggs, unless those eggs have been frozen at a much younger age and thawed, or if they have embryos from their eggs from a much younger age.
Is this going to affect the health of the child at all?
So not if the egg is young. So if it's their own egg from when they were younger, that has been thawed, or embryo.
As opposed to an egg, if I'm getting pregnant at the age of 50 and it's not a young egg.
Correct, that's right. So donor eggs, donor embryos, or eggs from when that woman was younger, or embryos from when she was younger, are going to give a good outcome as far as the baby goes. But her eggs at that time that she's over age 45, in that rare chance she gets pregnant under 1%.
The 45-year-old eggs.
Correct. Yeah.
Bottom line, what's your advice to women and to men, parents?
So there is some controversy, obviously.
Yes.
Our medical society really defines advanced reproductive age as over age 45. If the woman's healthy enough, or if her body can tolerate pregnancy, if she doesn't have pre-existing medical problems, severe diabetes, severe high blood pressure, and has a clean bill of health for the most part, and if there's a social support system, and also the partner's age matters too. If she has a partner, sometimes the woman's single, but if that's their reproductive right and they want to try for pregnancy, that is their right. So it's one of those situations where physicians can actually refuse treatment, but I think most of us consider it on a case-by-case basis.
Talk to your doctor.
Talk to the doctor. I mean, there are some health risks during pregnancy sometimes.
Thank you so much. I'm sorry, we're out of time, but great advice.
Thank you.
And we will be right back.
I need you to do enough.